the Democratic Republic of Congo is facing a new health crisis. This nation, already grappling with numerous challenges, now finds itself at the epicenter of a mysterious and deadly outbreak. The streets, usually filled with the vibrant energy of daily life, are now overshadowed by an air of uncertainty and fear. A mysterious illness has emerged, leaving communities in a state of panic. Families are deeply worried as they witness their loved ones fall ill without any clear understanding of what is happening. The sense of dread is palpable, as the illness seems to strike without warning. It has already claimed the lives of over 50 people, and the number continues to rise. The sight of mourning families and the increasing number of graves is a stark reminder of the severity of this outbreak. Each life lost is a tragedy, and the community is in mourning. The most alarming aspect is the speed at which it kills. Health workers are racing against time, trying to save as many lives as possible. The rapid onset of symptoms and the swift progression of the illness leave little room for error. People are dying within just 48 hours of showing symptoms. This rapid decline is unprecedented and has left the medical community scrambling for answers. Hospitals are overwhelmed, and the urgency in the air is palpable as every second counts. This rapid progression leaves little time for treatment and raises serious concerns about the potential for a wider outbreak. Healthcare facilities are stretched to their limits, and the sight of health workers in protective gear highlights the gravity of the situation. The fear of a wider spread is ever present. Health officials are working tirelessly to identify the cause of the illness and contain its spread. Teams of experts are conducting tests, taking samples, and analyzing data around the clock. The hope is to find a breakthrough that will help curb the outbreak and prevent further loss of life. The international community is also being called upon to provide support and resources in this critical time. The symptoms of this new disease are concerning. Patients experience high fever, often accompanied by severe headaches and debilitating joint pain. Internal bleeding is another terrifying symptom. This combination of symptoms points to a serious infection. However, the exact nature of the pathogen remains unknown. Medical teams are working to analyze blood samples and tissue from the deceased. They hope to isolate the infectious agent and develop a diagnostic test. The outbreak appears to have originated in the village of Boloko. 3 children who tragically died are believed to be the first victims. Reports suggest that these children consumed a dead bat before falling ill. While this initial link to animal contact needs further investigation, it raises the possibility of a zoonotic disease. This means the illness could have jumped from animals to humans. The epicenter of the outbreak is in 2 health zones, Bolomba and Basankusu. These zones, located in the northwestern part of the Democratic Republic of Congo, are home to remote villages. The limited access to healthcare in these areas poses a significant challenge to containing the outbreak. The densely forested environment and the reliance on the Congo River for transportation further complicate efforts to reach affected communities. The Democratic Republic of Congo's healthcare system is already strained. It struggles with limited resources and inadequate infrastructure. The sudden surge of patients with this unknown illness is pushing the system to its limits. Hospitals and clinics are facing shortages of essential medical supplies, including beds, medication, and trained personnel. The lack of proper sanitation and hygiene in many areas further exacerbates the risk of disease transmission. Echoes of the past. Comparisons to Ebola and Marburg. The haunting memories of these deadly viruses still linger in the minds of many, especially those who witnessed their devastating impacts firsthand. This new outbreak has stirred memories of past epidemics that have ravaged the region. The scars left by Ebola and Marburg are still fresh, and the fear of another similar catastrophe looms large. Communities that have faced these horrors before are on high alert, bracing themselves for what might come next. The speed of its spread and the severity of the symptoms draw comparisons to Ebola and Marburg virus diseases. These viruses are known for their rapid transmission and the brutal toll they take on the human body. The new illness seems to follow a similar pattern, spreading quickly and causing severe, often life-threatening symptoms. These hemorrhagic fevers also originated in the rainforests of Central Africa. The dense jungles of the Congo and surrounding regions have been the breeding grounds for these deadly pathogens. The rich biodiversity, while a treasure trove for nature also harbors these dangerous viruses, making the region a hotspot for such outbreaks. They caused widespread fear and death. The impact on communities was profound, with entire villages being decimated and healthcare systems being overwhelmed. The psychological trauma and the social disruption caused by these outbreaks are still felt today. People remember the fear, the uncertainty, and the loss that came with each wave of infection. While it's too early to definitively link this new illness to Ebola or Marburg, the similarities are alarming. Healthcare workers and scientists are racing against time to understand this new threat. They are meticulously studying the symptoms, transmission patterns, and potential origins of the disease. The goal is to identify it quickly and develop strategies to contain it before it spirals out of control. The world watches with bated breath, hoping that history does not repeat itself. Global response. The WHO and local authorities join forces. The World Health Organization, or WHO, is closely monitoring the situation in Congo. They are working with the Congolese Ministry of Health and other international partners. Teams of epidemiologists, virologists, and other experts are being deployed to the affected areas. Their primary mission is to support the ongoing investigation, strengthen surveillance systems, and provide technical guidance on outbreak control measures. Obstacles in the path. Challenges to containment and treatment. Containing the outbreak presents numerous challenges. The remoteness of the affected villages makes it difficult for healthcare workers to reach patients and provide timely care. The dense rainforest terrain and limited transportation infrastructure pose logistical hurdles to transporting medical supplies and personnel. Furthermore, cultural beliefs and practices, such as traditional burial rituals, may inadvertently contribute to the spread of the disease. A looming threat: zoonotic diseases and global health security. Zoonotic diseases, which are illnesses that can be transmitted from animals to humans, have been a persistent threat throughout history. However, in recent years, the frequency and severity of these outbreaks have increased, raising alarms about our preparedness and response capabilities. This outbreak in the Democratic Republic of Congo is a stark reminder of the growing threat of zoonotic diseases. The Ebola virus, for instance, has caused multiple deadly outbreaks in the region, highlighting the urgent need for robust health systems and international cooperation. The impact of such diseases is not confined to one area. They have the potential to spread rapidly across borders, affecting global health security. These illnesses, which originate in animals and spill over into human populations, pose a significant risk to global health security. Factors like deforestation, climate change, and urbanization are accelerating the emergence of these diseases. As humans encroach on wildlife habitats, the chances of encountering new pathogens increase. This encroachment disrupts ecosystems and brings humans into closer contact with animals that may carry unknown viruses. Increased human-animal interaction is a major contributor to the spread of zoonotic diseases. Activities such as hunting, wildlife trade, and even ecotourism can facilitate the transmission of pathogens from animals to humans. Additionally, climate change is altering the distribution of wildlife species, bringing them into new areas where they may come into contact with human populations. This complex interplay of environmental and human factors makes it challenging to predict and prevent outbreaks. Strengthening global health surveillance systems is essential in detecting and responding to zoonotic diseases. Advanced technologies, such as genomic sequencing and data analytics, can help identify new pathogens quickly and track their spread. International collaboration and information sharing are also crucial in managing outbreaks effectively. By working together, countries can pool resources and expertise to combat these threats. Investing in early warning systems is another critical step. These systems can provide timely alerts about potential outbreaks, allowing for rapid response and containment measures. Field monitoring and research are vital components of these systems, as they help scientists understand the dynamics of disease transmission and develop strategies to mitigate risks. Training healthcare professionals to recognize and respond to zoonotic diseases is equally important in ensuring a swift and effective response. Promoting responsible interactions with wildlife is crucial in mitigating the risk of future outbreaks. Public education campaigns can raise awareness about the dangers of close contact with wild animals and the importance of conservation efforts. Encouraging safe wildlife tourism practices and implementing health and safety policies in communities can reduce the likelihood of disease transmission. By fostering a culture of respect and caution towards wildlife, we can protect both human and